Hi, I'm Amber Ballard, and I have read and understand the syllabus and rubric for this course. I think that it is important for nurses to study health policy so that we can understand just better how the healthcare system works. By understanding policies, we can identify problems within the system and be able to advocate better for both ourselves and our patients. One reason I'm looking forward to taking this class is because I want to be able to kind of learn how to make a change. I think that it's really easy for us to make suggestions. If we're working on a certain unit or something, it's easy for us to say that something should change, but I think it would be very helpful to know how to actually implement a change and how to make it happen. So, one really small example that I could think of is I've been a nurse for almost 7 years, and I've worked on a couple different psych units. And so I've kind of seen those policies and how, and what they have in place in order to keep patients safe and also the staff safe. And I recently was a sitter on a unit for a psych patient. And right when I walked into the room, I noticed that the patient still had their phone, or not their phone, but the room phone that had a cord, and they had their call light, which also was a cord. And, so I immediately started thinking about how those were both a hazard, and generally they're not allowed to have those things because they can harm themselves with it. And then a little bit through the shift, this patient had a friend bring in a bag of belongings, and they set the bag right next to me, and I looked down at it, and I noticed that the bag contained some sort of sharps object. I can't remember specifically what it was, but it was like nails or something that was not necessarily something that the patient would need at the time. So I asked them if anybody looked in the bag before they brought it in, and they said no. And so I ended up talking to my charge nurse about it and asking them what the policy is for a psych patient. And they kind of acted like there wasn't anything in place. And so this was something that I actually ended up emailing my manager about, just so I could clarify what the policy actually is for these patients. And it's not that I thought that this patient necessarily was a risk. I didn't feel that way, but I wanted to know what the policy was for future situations, because just because that patient isn't going to be a risk, some of them are. And if they have, objects like that, they could harm themselves, or they could harm the staff that's in there sitting with them. So I just feel like it's very important to understand what the policies are, and when you think that something, is a little off or is dangerous or unsafe for a patient or for the staff, I think that we need to be able to kind of run that up the flagpole and be able to implement change.